Okay, in this video I want to go over Zeba's case review. So I'm going to actually see her this morning, and I just want to go over the first impressions of going through the case study. So in summary, basically, Zeba's 59 years old, and if you look at her chief complaint, she's got chronic gastrointestinal symptoms of bloating, indigestion, irritation, like reoccurring gastric ulcer type symptoms, going on a histamine-free diet, and a FODMAP diet seemed to help. She has worked with some Ayurvedic practitioners and been given all these different diagnoses that try to explain some of her symptoms. But really, as we get into the case review here, just to give you my first impression, it seems like she's got some early patterns of peripheral arterial disease. She has some temperature differences between one limb to the other, and she may even have some vascular dementia disease, and she may have some potential Sjogren's. So those are my initial impressions when I was going through her case study. And ultimately, as we go through it, you'll see she went to her regular family physician, said there's really nothing wrong with you, maybe some IBS, and then started to journey outside of that and really veered off into a complete lack of any accurate healthcare diagnosis. And she, is kind of stuck in trying to figure out what to do. So you can see she's on Zyrtec and Mucinex, so she's doing some things to impact her gastrointestinal digestion there. Look at all the supplements she's taking here. She's taking basically different probiotics, a product called GI Detox. He's taking the Dr. K's protocol for SIBO, which is the protocol for SIBO that I use. These are from Apex Energetics, and these are all compounds that help support some of the imbalances in SIBO, and she reports that helped her. So and she has some tolerance to carbohydrates. She never had a FODMAP test, so we suspect that may be there. And then you can see she's taking like antihistamines, magnesium, selenium, fish oil, quercetin, but she's basically taking, it says 23 supplements, but here you have 4, 5, 6, 7, 8, 9, 10. She's taking close to 30 supplements a day. And she's really confused to do with her gut, and let's go through some of her case history here first. So you can see, like in 1989, 89, she had these urinary tract infections that kept reoccurring. When she supported her immune system a little bit and taking some vitamin C and cranberry juice, they basically stopped. Her mom has a history of dementia, and if you look at the way she's written this report and then her timelining and sentencing, it doesn't look good. So there's this. We definitely want to go through in the exam today and definitely do a Montreal cognitive assessment form. See if she has any mild cognitive impairment, and look at her speech, look at her conversation, and see how she's doing. She writes that my left leg feels colder than my right leg at night. So asymmetry of circulation and blood flow is always a sign of peripheral arterial disease. And if she has peripheral arterial disease, then we know her vascular endothelium is significantly compromised. Now her risk for heart attack, her risk for stroke dramatically go up. Her risk for vascular dementia dramatically go up. And when you see like this discrepancy in all the healthcare professionals she's seen and no one's done anything about that, it's a problem. So she had fibroids, and then she became anemic from the fibroids, and then they resolved that with a hysterectomy back in 2004. She has this recurring heartburn issue. It seems to be triggered by stress. So it doesn't seem like she's very well. Everyone has stress, but some people have better or less stress adaptation than other people. So it doesn't seem like she has very good stress adaptation. Again, we don't know the severity of the stress, so she could just have stress that's beyond any physiological adaptation. So we had to figure that out more. But if it's just like stress everyone else has, like job's tough or life's hard and all of you getting heartburn, then the adaptation levels need to be improved. So when you do get stressed out, obviously cortisol levels go up. Cortisol levels thin out the lining of the gut, which makes it more vulnerable to breakdown, and then suppresses the immune system, suppresses IgA, gut immune system function. The person becomes more prone to H. pylori infections. Also, when people are under stress, they get into that sympathetic stage more, and that sympathetic stage decreases output of enzymes. So lack of hydrochloric acid induced by stress, thinning of the lining of the gut induced by stress, weakened IgA levels can make someone really prone to getting an H. pylori infection and then developing heartburn. So she has some issues with that. And then if you see here, my body began to feel very cold, including my hands and feet. We can see some signs of poor circulation. And then when you read it, something like anxiety increased, brain function decreased. Maybe that's a typo, but there's quite a few of these throughout the report. So again, these symptoms and some vascular issues in her age, 59. We probably are really worried about patterns associated with vascular associated dementias. Let's see what else she has here. So in 2007, her abdominal pain was bad enough where she had to go to the emergency room. There, she was suggested she had gastritis. Just really doesn't seem like they did any kind of diagnostic testing or workup or referred her out for any kind of testing. 2012 had bladder infection. Dun. And then, you see all these crazy, like, I don't know how to say this. Like here you see acupuncturist, Ayurvedic practitioner, and neurologist, MD. This is all apparently the same person. And there's a lot of paper mill, diploma mill, Ayurvedic MDs from India, and then even neurologist MDs and endocrinologist MDs. And when you look at some of the diagnoses that have been done by this Ayurvedic practitioner, there's absolutely no way they are trained as a healthcare professional. They're just going into theoretical theories of nutrition and food and really sticking to Ayurveda. But if they had any actual training in basic diagnosis, she would have had a better workup. Anyways, so she goes in, she gets diagnosed with different types of patterns related to Ayurvedic medicine, never really gets a mechanism of diagnosis of what's going on. Dry eyes, bloods are dehydrated. Her dry eyes, we got to see, with her history, does she have Sjogren's disease? Does she have environmental allergens causing dry eyes? We have to go from there. And then she finally gets diagnosed with osteoporosis in 2017. That's probably been there for a while. She gets a molar implant in 2018 in the upper left side. When anyone has chronic infections, autoimmunity, we're always worried about dental type infections and patterns. She has some GI map and Dutch hormone test, diagnosed with SIBO and progesterone estrogen imbalances. Now here she writes she can't tolerate noise and don't have a television. So basically people that have intolerance to noise can have, for example, some patterns of cochlear nerve injury or damage that can make them very sensitive to sound, but even more common that it's really a brain-based mechanism. The way it works is sound comes in through the auditory pathways. These auditory pathways really have a powerful impact on an area of the brain called the inferior colliculus, and the inferior colliculus is directly linked to the autonomic sympathetic centers. So if you hear something really loud, you can respond quickly and get away. And this area is dampened by, what I call basoganglic indirect loops that impact this whole limbic system. So again, all this tells us is we got to do a really good evaluation of her brain, make sure she's okay. There could be some patterns of like frontal temporal dementia, vascular dementia that may be involved in the big picture. She was seen by naturopath. Seems like the naturopath did a pretty good job. Diagnosed her with SIBO, looked at some hormone imbalances, progesterone, estrogen, supplementation was used, put her on some things to support her gut, and gave her some leaky gut support. She seemed to have some regained energy doing that, but no weight recovery. And again, I guess her SIBO, doctor thinks SIBO flared up. She had some reactions there, but they have to figure out more about what happened here in the history and just see what's happening. There's only so much you can get with basic early paper documentation without actually doing your medical history first. And then here she starts to get diagnosed with histamine intolerance by the Ayurvedic practitioner, and then which then tells her to eat her a lot of wheat and get off bone broth. She feels like getting off bone broth may have helped her. We got to really, when I read this report, to be honest with you, I think she's very impressionable. Like everything a practitioner tells her, she starts to really think it's true, and that's a red flag. So we got to really make sure that we get accurate information from her, and she can start to critically think about her symptoms and signs as we work with her. And then we look over here. Again, pointing out she tried the FODMAP diet. The FODMAP diet really helped getting out the bone broth. Apparently, seemed to make some difference there for her, being the link being associated maybe to higher histamine from the bone broth. And then she, in 2019 onwards, my condition began to improve gradually as I identified FODMAP, food use, started taking CPO supplements. So I think you can see a big impact on her health when she started to focus on her small intestinal bacterial overgrowth and do the FODMAP. It's one of the most diagnostic things is when you see actually someone have a positive response to a protocol. It's almost telling you what the diagnosis is. And almost like most diagnoses can't be confirmed until you actually see what helps them. And then that's the key part of this. And then January 2021, had some ricotta cheese, sweetened dairy, noticed saw a rash. So there could be some intolerances to dairy. And then on the section of the case review here, number 5, provide a list of diagnoses given to you and brief your personal opinion about them. She goes, went to a regular MD, all is well, might just be IBS, totally disagree. She knew there's something wrong, but anyways. Ayurvedic acupuncturist said very dehydrated and stressed. Well, honestly, it wasn't. Obviously, it's not going to be enough to diagnose her patterns. Ayurvedic practitioner here, Veda Dasha, extreme imbalance. So she got some Ayurvedic diagnosis. Told her to eat wheat, gave her some nightshades, flared up her immune system, wasn't really doing well there. 2017, went to a Ayurvedic neurologist, MD, which most likely not legitimate. And more of the same. No real workup there. And then naturopathic doctor seems to be the first person to really come in here and start to help her. Now she says treatment has helped a lot, but not able to identify the root cause. So we got to ask her like what she really thinks the root cause is. Seems like there's some differences and confusion about what the root cause is. This pops up quite a few times in his history, and it's important to know what mechanisms may be driving her pattern. Sometimes, there's a very strong likeliness that she just has some inflammatory ongoing conditions in her gut for a period of time. She may have injured her nerve plexus. She may have SIBO associated with that. But there's definitely also concerns for vascular disease. And you have to understand that vascular disease throughout the body, like in the peripheral arteries, can also cause lack of blood flow to the gut. So there's blood vessels that go to the gut. So when you see blood vessels that are impaired and have atherosclerosis and plaquing that go to the legs, and then cause like an abnormal ankle brachial index, which is something that's really important for us to check with her. We also have to be worried about vascular blood flow to her gut. And there are people that will have their enteric nervous system totally dysregulate when they have vascular disease. And if there's not proper blood flow to the gut, you do have degenerative changes that take place in the gut nervous system as well. Just like you would have vascular dementia cause degenerative changes in the brain. So there's some possibilities there. With her temperature discrepancies between extremities, that's definitely a possibility. And then she writes here, thyroid test came back positive, recommended medicine, but was not able to treat thyroid properly. We need to find out more about that. 2018, I guess she started taking some of my online courses. I have some online courses for the general public at Dr. K News. Like I have one course called the Gut Puzzle course. She probably took that and realized she probably had SIBO and started to take supplements that helped her. That seems to be what's making a difference there for her. And then, stress keeps coming up. And then if you look at the, number 6, what is your opinion? What things happen to your health? And she feels that, stress was a big trigger for some things. Then she got the fibroid, then she got the anemia, and then she finally got the hysterectomy, and she got more stress, and then she got another gastritis response there. And, now she's got brain fog in the morning. She has noted a relationship between her gut and brain connection, and when her gut's healthy, her brain functions much better. Taking enzymes seem to really help her. So those are the basic background information here. And then when you look at the rest of it, not so much things that are so critical, things that really helped. Supporting her SIBO pathways, you can see GI support seems to make some type of difference for her. Things that made her feel worse, decreased health, eating a whole wheat diet, ashwagandha, nightshade, supplements that have lactose in them. Those were key patterns there. She did have an endoscopy 2009. Back then things were normal, so we don't and then we're not sure she had anything in 2007 for the gastritis diagnosis. And then we can go through and just take a look at some of her questionnaires and some of her labs that may be relevant. So I highlighted some of the things that were important. Cold hands, cold feet, must wear socks at night. So we know we have some poor circulation issue. So the poor circulation issue could be like she's got something happening with her heart. So we definitely want to listen to her heart very well, do an EKG, check all her pulses, do an ankle brachial index. Make sure you do a Doppler, make sure she doesn't have any patterns of venous insufficiency. Just make sure her cardiovascular health is okay. So there really has been very little to zero workup on her cardiovascular system despite having asymmetric circulation issues. So wakes up in the middle of the night, that's classical hypoglycemia. We got to see if she's got any blood sugar issues. She has difficulty consuming raw nuts and seeds. She has difficulty digesting foods, bloating all the time, brain fatigue when body's inflamed. So there's definitely some neuroinflammatory patterns there. Changes in brain function with stress and poor sleep. That's significant. That happens all the time with her. Overwhelmed with that, unable to handle stress here. She may not have a very good stress adaptation process. So we got to make sure she's like getting exercise, getting movement. She has social relationships that are healthy. She has a community she can talk to. All the things that are necessary for stress adaptation. So, community, social interaction, proper sleep, physical movement are the most important things when someone has stress they can't handle and they need to improve the stress adaptation. Now, if we look at the brain region localization form, the most important symptoms, everyone's going to have zeros and some ones, throughout the form. We're really concerned more about our 3s and 4s, and then 2s can be a little bit of a red flag. Mental fatigue, decreased attention span, 2, that's just, it has symptoms maybe half the time. And these may be just related to her poor blood flow, for her poor vascular dynamics, but we're not too concerned. And as we look at the rest of the form, there aren't really any major symptoms that show up. And then we start to see some 2s here with some symptoms associated with the medial temporal lobe. This is the area of the brain that starts to show signs with early Alzheimer's disease. Nothing too significant there. Her cerebellum, just no symptoms with her balance posture in patterns there. Basic ganglia, some cramping of her hands when she writes. That may also be related to circulation. We're going to make sure she doesn't have any patterns of dystonia, like for example, the direct pathway, any rigidity or stiffness, but no real symptoms of things like early Parkinson's disease. Dry mouth or eyes, slow bowel movements, chronic digestive complaints. So these are all signs of decreased parasympathetic activity. And, with dysautonomia, you see a lot of sympathetic activity and impaired parasympathetic activity. I don't know if this is full-blown dysautonomia, but she definitely has some mechanisms here. Now, her dry eyes and mouth just may be environmental allergens, and then her gut motility is just off, or her, her whole parasympathetic pathway may be involved. Sometimes even diseases like multiple systems atrophy, they start to degenerate autonomic nerve plexus, but that will see some Parkinsonian patterns, and we'll have to see if she's got any kind of shuffling gait or any mask face, any rigidity, anything associated with that. And then here when we look at areas where there's increased neurological spontaneous firing, like seizure activities, any spontaneous activity, she has some tinnitus here. That's about it. And she has some flashes of light, jagged lines in visual field. And this happens when there's hypoxia to the brain, specifically to the occipital lobe. She may have some blood flow dynamic issues that are involving her brain there. And this is the metabolic assessment form. And she basically has, symptoms associated with gastric irritation that seems to be ongoing, and symptoms associated with inability to digest fibers, and symptoms associated with small intestinal bacterial overgrowth when you look at those. She's got some electrolyte imbalances that seem to be involved, but poor muscle endurance, frequent urination, frequent thirst. So we have to see what's happening here. And some of her electrolyte imbalances may be causing some of her constipation issues as well. So we want to look at that a little more deeper. And also got to make sure she what's going on with the thyroid, and that's been evaluated properly. Now, when you look at some of her lab work that we'll go over in a second here, she does have this ongoing thyroid underconversion issue. So that could be something we have to confirm with updated lab tests and see if that's still an issue. So she has difficulty falling asleep. She has difficulty staying asleep when you look at this. This is the organic acids test. And I know some of you guys like this test, but this is such poor reliability with some of these markers that are up. I'm not saying every marker on this test is bad, but seriously, arabinase in urine for yeast overgrowth, give me a break. That's doesn't mean much. This Krebs cycle diagram with citric acid cycle and making this assumption or dissecting this in any real way total joke. These neurotransmitter pathways that allegedly are going to be what's happening in the brain, again, total joke. That's not how these things work. And then all these neurotransmitter imbalances, these have nothing to do with the brain. This is where, the Great Plains, I think, does some good environmental testing. Then when they do this type of testing, it's just like, makes you frustrated with the entire field of functional medicine and the labs that serve functional medicine, because they literally cannot do a critical review of the literature and implement it. And there's a high degree of just acceptance in the functional medicine community for any kind of lab test, which is a problem. Like this diagram of a neurotransmitter synapse by urinary metabolites. Total joke. Anyways, let's go into the case. So I don't find that to be useful. Now, when we look at the urinary isotoxic metals, we can see that there's no elevations here. This is a reliable test, validated very well. Mineral testing with hair minerals, this is not a validated test. So we have to kind of skip through that. When you look at labs, you have to consider the degree of evidence and the degree of specificity, sensitivity, and reproducibility when you start to make your clinical decisions. This is a GI map panel, DNA stool analysis. Basically what you're seeing here is just some patterns of dysbiosis that are really showing up. Yeast overgrowth, bacterial overgrowth. So her gut's not healthy, and with all her GI panels we see some degree of that. So that's important to note. And then when we look at a blood test in 2020, by the way, let's see, look at this GI panel. Let's look at the date here. The date of this test. Let me go back. Sorry to scroll down like that. 2020. So this is a couple years ago. And then when we look at a blood test, everything seems, pretty much within normal range. Her glucose is 78. That's within the normal range. But when we see glucose levels below 85, we start to suspect hypoglycemia. She has some hypoglycemia symptoms. So we want to see if she's keeping her blood sugar levels stable. The rest of her lab work, if you go through it, seem okay. Her iron saturation is just, nothing significant. Just a little bit elevated here. Total cholesterol here is 257. LDL is 164. Now, does this matter or not matter? It really depends on the big picture. Now, if she has peripheral arterial disease and she has vascular dynamic imbalances and abnormal pulses and circulation issues that are related to that, these need to be further investigated. So it's very likely that I would like to do a further cardiovascular exam and also do some vascular testing and maybe even get her out to get a coronary artery calcium score, just because of her asymmetry in her temperature and her limbs. Now, when we look at the rest of her levels, things that are really popping out here is she's got this underconversion pattern, this T4 to T3 conversion. The levels of T3 are 57. We like to see these at least 100. So even though she's not showing hypothyroidism here, she's right on the border, but she doesn't have any antibodies, and she's got this conversion issue there. Vitamin B12 is elevated. That'll always happen if she's taking any kind of supplement with some B12 in it. This is a serum B12 marker. And then I'm going to skip all these follow my health sections. When you go through it yourself, you're going to see there's pretty much nothing there. Some of these labs, they just give you one biomarker at a time on one page. I think they do it to make it seem like they're giving you a lot of data. They could all be put together on one piece of paper, but they don't do that. You see that with HMOs as well, too. Just the way they have it set up on their computer. Okay, let's keep going. By the way, if scrolling down bothers your eyes and makes you dizzy, you may have a vestibular issue yourself. We're actually activating vestibular optic kinetics doing this. Okay, let's keep going. Okay, let's get to this blood test here on the... Oops. I think I lost it here. Let's get to the blood test. Here we go. This is 2021, so this is about a year ago. MCHC is slightly low. That doesn't really mean anything. She's not really anemic when you look at her blood work. Her RBC is 3.99, hemoglobin is 12.1, hematocrit is 38.5. She's still within normal, even within the borderline limits of being okay. So really nothing significant there. And then we look at the rest of her panel here, her blood tests. Again, below 85 or a little, we always want to look at that. See if there's any hypoglycemia symptoms. She has some in her metabolic assessment form. And then here we look at her transaminase, slightly elevated. It's 42. Any tissue that breaks down, skeletal muscle, cardiac muscle, lung muscle, any tissue that breaks down will raise ALT, SGPT a little bit. It's hard to say what that could be. You can see your fasting insulin levels fasting is low. And then you can see your cholesterol LDL levels are a little bit high here. Fasting insulin levels being low, you'll see that sometimes with people that are more on the hypoglycemia side. Now here we see her TSH is elevated, so we gotta find out what's happening with her thyroid. Is she hypothyroid? Now, thyroid hormones have a huge impact on gastrointestinal motility and activity, and there's some people that have SIBO. As soon as they go on thyroid replacement, their SIBO is cured. So we have to see what's happening there. And then she definitely has that underconversion pattern that's showing up here. Like her T3 levels are 45, her free T3 levels are 1.7, her T4 levels are within normal reference range. She's not converting T4 to T3, and she may have some hypothyroidism, but her antibodies are negative. So something to look into there. So we'll probably want to do an updated, in addition to just doing more of a thorough cardiovascular evaluation, we want to make sure that she doesn't have any underlying thyroid issues and that she needs to work with her physician to get on some replacement. That would be necessary. And then let's go through the rest. And I think the rest of this is just this one page of each single biomarker. Okay, she does some testing, nothing significant that shows up with the rest of with her workup here. Okay, so that's the basic case review. So I think what we're going to have to do is we're going to the red flags for this case is that there's peripheral arterial disease and cardiovascular involvement. That peripheral arterial disease and cardiovascular involvement can definitely increase the risk for a cardiovascular event. So more than likely we're going to want to do some laboratory evaluations. Within temperature imbalances, we want to do coronary artery calcium score right off the bat. We want to dig deeper, see what's happening with the thyroid, get an updated lab work there. And then our physical exam will be really important. We want to see if she has any signs of mild cognitive impairment, see if anything's gone with her brain. She has a knee injury. She suspects she may have some nerve injury damage there, so we want to take a look at that. It's going to be really, really important to check her pulses, check the ankle brachial index, try to figure out why her temperature differences are there. And those are the main things that I'm picking up while I get her case review. So I hope this was helpful. Thank you.